From Heart's Delight to Coral Harbour, Nunavut, Stacey Button's commute to work is a long one, but it's a decision she doesn't regret. Button is a travel nurse, a licensed practical nurse who lives here but works away. She used to work in Springdale but left after one particularly difficult incident.
I was assaulted at work by a patient in 2022, and I didn't really get any support. I didn't get any support from management, and that person stayed in the hospital for many, many weeks after that had happened. And I just couldn't, after that had happened, it was a while after, and I had to leave.
She went north, far north, where she says working conditions for healthcare professionals are much better.
Right now, I can't imagine there would be anything that would bring me back here to work here the way things are.
Button says at the Nunavut clinic where she works, if a patient mistreats staff or gets angry, management steps in so those behavior issues aren't the sole responsibility of nurses.
The expectation is here that you as a nurse, if someone gets irate or mad, you are expected to calm that person down, and that really shouldn't be.
Plus, she enjoys her responsibilities at the clinic.
I have pre-op interviews with patients. I do driver's medicals. I do all the blood draws. I run the point of care testing lab. I do all kinds of stuff. It's very interesting.
And when she's home, she's home.
I can't imagine that I would ever want to give this up.
Button says nurses want 3 things: more respect at work, more money, and more flexibility.
A lack of flexibility is what forced Angie Regular out of her nursing job in Springdale.
In summer of 2023, I had asked for a leave of absence due to having issues with childcare. I have a little one, she's now 4. And I had asked for a leave of absence up to a year until she was old enough to get into a daycare.
But she says the health authority denied her request.
I felt like I had no other choice but to leave nursing in Newfoundland to do travel nursing. That way I could pick up contracts when my parents were available to babysit for me.
Now Regular has found a different line of work outside of the healthcare system, but even though she's desperate to get back to the nursing profession, a full-time nursing job doesn't work with the needs of her family. And as an LPN, she says she hasn't been able to get any casual work in Springdale.
It really hurts. I spent 10 years here in Springdale, and I wanted to come back a year after once my little one got in daycare. I was here all summer in Springdale, willing to work and wanting to work, and I felt like I was being denied.
Regular says recruiters are offering her travel nursing positions in Western Newfoundland, but she wants to work in Central because she loves nursing and her community. If a casual nursing position was available, she says she would return to work tomorrow. Jenna Head, CBC News, St. John's.